It's really unfortunate that the only time that we actually talk about anything and take things seriously is when tragedy strikes. Look at the school shootings in this country. We've had so many, and the only time that individuals are willing to even talk about gun reform is when school shooting occurs. Now, nothing's going to happen, and I think that each time a school shooting happens, that conversation is shorter and shorter than it was before. And look at health insurance in this country. Right now, we have Luigi, who is on trial for killing United Healthcare CEO. And by the way, when I talk about this, I don't condone violence. And I think a lot of people have been really confused by the fact that a lot of people are talking about health insurance and expressing lack of empathy for the United Healthcare CEO that was killed. And sometimes when I'm confused by someone's reaction, I go, let me try to understand them because this is pretty confusing, right? And I didn't need to go too far, to be honest, because I know my own personal experience with my father and health insurance. He needed a transplant. His insurance dropped and they took him off the transplant list. And we had to scramble to get him back on the transplant list so he could have that procedure. But I know from that experience that in my situation, my father was able to get that procedure. There was other people probably who did not get back insurance and thus did not have the transplant and died. There's been stories where a surgeon was mid-surgery. They had to stop to take a call from insurance and they were like, hey, this doesn't look like you should be doing the surgery. We're denying it because there's other things that you should be doing instead of this. And the surgeon was like, this is a life-saving procedure. They're going to have this surgery. They need it. I recall a story with a friend who was undergoing surgery, was put under anesthesia. The anesthesiologist had to take him off anesthesia to wake them back up. And then they were told that their procedure was not covered. And they were like, what do you mean? And they were like, well, your employer doesn't decided that your insurance package would not cover this procedure. And she was like, why didn't you check before? And they were like, this is such a common covered procedure that we didn't even think it wouldn't be covered. So we're in an environment where we pay health insurance to deny us when we most need it. And it seems like such a cruel, you know, program and system that we're denying you when you need it the most. So, health insurance in America, to me, is a gatekeeper to healthcare. Health insurance and healthcare are not the same thing.